Good afternoon, dear audience. Thank you for coming back. Let me introduce my PhD projects. I'm Koppány Kocsis. I'm working as a specialist in Uzsoki Hospital, Orthopedic Traumatology department. My vision is to give a better attendance to our patient with a faster and more accurate diagnosis. The mission is to learn, overview the literature and get a practice in musculoskeletal ultrasonography. To gain this aim, my research will be the comparison of the diagnostic accuracy of ultrasonography and MRI in the lateral ankle ligament injury and medial collateral ligament injury of the knee. My first topic is comparing the diagnostic accuracy of ultrasonography and MRI, assessing in the lateral ankle ligament injury. The lateral ankle ligament is one of the most frequent injured ligament of all body, and the typical mechanism of the injury is an inversion trauma. Somebody step on a rock or step into the hole, and it makes a supination stress. Currently, we are in the phase of manuscript writing. Our target is a D1 journal called Radiology with an impact factor 7.6. We didn't have evidence that a clinical test can evaluate the level of the injury. However, the treatment depends on it. When we would like to know surely how serious is the injury, nowadays we are using MRI. However, ultrasonography could be a good alternative because it's widely available, not so expensive in contrast to MRI, and it can be provided immediately at the first patient visit. Our aim is to compare the diagnostic accuracy of ultrasound and MRI. Our clinical question is, ultrasonography is good enough to quantify the injury? We check the acute ankle injured adult patients and compare the sensitivity and specificity results of ultrasound and MRI findings. Overviewing the literature, we found 10 eligible articles that examine the specificity and the sensitivity of the ultrasound compared to MRI. The sensitivity. The sensitivity shows the possibility of finding an injured patient. In the 9 articles we could examine 367 injured patients and found 352 positive cases with ultrasonography. It's 97%, which is a very high sensitivity in a diagnostic method. The population was homogeneous. The specificity shows the likelihood of finding a healthy patient. In the 9 article we could examined 152 healthy patients and found 141 negative cases with ultrasound. It's 93%, which is high sensitivity. This is a common form of visualization of a diagnostic tool efficacy. On the vertical pivot there is sensitivity, and the horizontal pivot there is 1 minus specificity, as known as false positive rate. The summary estimate marked with blue square there is in the upper left corner. When there is much better the diagnostic tool, the summary estimate takes place closer to the upper left corner. The calcaneofibular ligament injury was found in 7 articles beside the anterior talofibular ligament tear. It has a close location to the ATFL, and the mechanism of the injury is almost the same. Less frequently injured than the ATFL, but we can visualize pretty good with ultrasonography. From 178 injured patients, 143 was recognized as a positive case with ultrasound, which means 86%. The specificity of ultrasound examination is better related to calcaneofibular ligament. It's 96%. This is the two-dimensional regression of calcaneofibular ligament lesion. The summary estimate is in the upper left corner too. In summary, we found of the results, we found high sensitivity and high specificity of ultrasonography in the case of anterior talofibular ligament and calcaneofibular ligament as well. Or the Strangor study are the appropriately selected patient population and circumstantially documented cases. It will be the first meta that contains only acute adult injured patients, and we found low risk of bias. Or limitation, there were no randomized controlled trials available, and we found 9 articles we could involve in the statistical analysis. In conclusion, I can say that ultrasonography has high specificity and high sensitivity concerning the anterior talofibular ligament and the calcaneofibular ligament, therefore may be a good alternative of MRI examination in the diagnostic of lateral ligament injury. It could be primary diagnostic method in the acute cases. An appropriate classification system and practice is required for the examination. Our main aim is to give a better and more patient-specific treatment in case of ankle ligament injuries. Implication for practice. Ultrasound is easy to use, easy to follow up cases, but training is necessary. We can choose those patients who needs really MRI, and we can make new guidelines for treatment. We can offer for scientists to developing more sophisticated grading system to give better attendance for patients. In my second project, I will compare the diagnostic accuracy of ultrasound and MRI assessing in medial collateral ligament injury of the knee in a settings of clinical trial. The medial collateral ligament is the most frequent injured ligament of the knee during knee trauma. Still, we now have evidence that physical examination can grade the level of injury. Nowadays, MRI is the gold standard, but we would like to compare the diagnostic accuracy of ultrasound with MRI. We would like to use ultrasonography for grading the medial collateral ligament injury. The clinical implication of the ultrasound could be a good alternative device for quantify the ligament injury. I will examine those musculoskeletally matured patients who has no fracture on plain X-ray and no multiligamentary tears, neither meniscal tears suffered in knee trauma. At the first patient visit, I will be performed ultrasonography next to X-ray and physical examination, and I will send them to MRI in the same week they injured. And we will compare the ultrasonography and the MRI findings. We are planning to finish our first project in June, and we will start in August the second one. Thank you for your time and your attention.
I try not to ask questions, but everybody is obviously after lunch, so this is the worst time to give a lecture and then expect questions. In your first study, if we can look at those, yeah, this one, yes. So there is one study when there was only 3 persons included, and then there were 2 of what, which was actually was positive results of what. So is this really worth to include a study like this? So this is a well-done study that you cannot exclude, because I mean, all the other ones seem to be kind of reasonable sample numbers. And then you have one which is standing out. Probably they just tried something and then they published that somewhere. I mean, of course, I mean, you read the paper and then you know what is behind. So is this really worth to include?
Yes, because let me show the specificity. In this study, wrote Esmalian, found just 3 sick people, but they found more than 20 healthy. This is the third biggest population they are examined. Just they found a lot of negative cases, but it's a very good paper. It's worth to involve because the sensitivity is high, just the confidence interval is very wide because the low number of sick patients.
That also means that in some ways actually your outcome is affected by the pool. Because if the pool is not big enough, I mean at least for this, I mean for positive, then actually you may get results which may be misleading. Well, the other side is that if you do this in a meta-analysis and there are all these kind of big numbers, then this will actually not count a lot, if I'm right. So, but what you say is actually that they had actually many controls or many normal, and then in the normal, both methods actually showed no difference compared to normal.
There was no control examinations in these studies. They studied all injured patients. Just they didn't find ligament tear by them. The numbers are almost similar in the all included papers. In this topic, there are very small numbers they can involve, and we didn't find more paper nowhere. They can use wider patient population.